Hello, I'm Dr. Greg Winteregg, CEO of the Private Dentist Alliance. I want to talk to all of you students out there today who are wondering what your future is going to be like as a career in dentistry. As an assistant, as a hygienist, as a dentist, where is this profession going with the rapid increase of the DSO movement? I'm here to tell you that PDA is going to help you, and I want you to become a member today. It is free. Now, why should you become a member? You're going to get weekly video updates from me, and you're going to get regular updates of our newsletters from the Alliance on exactly what is happening and how we are going to help preserve and protect the private practice of dentistry. Now, to me, the most important advantage is you are going to get access to our job board. What is that? Our private practicing members all have access to our PDA job board, which means if they have an opening in their private practice of assistant, hygienist, doctor, front office staff, they're going to be able to post it. And you're going to be able to check up regularly. And as our membership grows, we're going to be covering larger and larger territories across the United States. If you are looking for a job in any position in the office of a private practice, you need to become a student member today. It is free. Go to www.privatedental.org and become a student member today. You're going to love your benefits. Do it now.
Welcome back to another episode of the Dental Student Vibes Podcast. I'm Seth. I'm here today with Mr. Matthew. Matthew, how are we doing?
We are doing well. Just living it up in our D3 year. Life is good. Classes are starting to slow down a little bit. Clinic is starting to pick up. So, I mean, I can't complain whatsoever.
Right. And, I mean, it's great finally getting into clinic and this is what we dreamed about doing. You know, this is what you think about when you go to dental school. Like, okay, yeah, you think about going to a sim lab and all that stuff. But when you finally start hitting the trenches and getting into clinic and start seeing patients, it's awesome, you know? And so I had a patient today, and it's difficult right now, you know, with the times that we're in, because a lot of schools are not able to do any procedures that produce aerosols and things like that. So what I had to do is basically a lot of emergency sort of reparative treatment. One of the patients, you know, crown fell off, etc. But so, you know, do a little fixing it up, maybe a little splinting, that sort of thing. That's probably the only procedure I can think of you can do, making a splint that doesn't produce aerosols but still involves composites.
That and dentures too. We had a denture repair. That was pretty cool because
what'd you do with that?
I personally didn't do it. I was a fly on the wall for it. So one of the, I guess my clinic colleagues was doing it, and then the preceptor stepped in, and then they ended up repairing it using I guess leftover acrylic or whatever, and then they jerry-rigged it together because they couldn't use the straight handpiece to, you know, file things down and, you know, smooth things. So they just jerry-rigged this thing together, and it worked really well until we can make them another denture. It was pretty cool though.
Interesting. So have you been doing a lot of dentures besides that?
No, not at all. I've been doing a lot of NPSs, new patient screenings. So the way it works is the patient comes in, you take a pano, you do an intraoral exam, extraoral exam, and then you do a brief medical history. And then based off of the pano and the findings, you determine if that patient would be suitable to be treated by a third-year dental student, if it's in our scope. And because we can't do a lot of aerosol procedures, a lot of these patients want results quickly. They want quick treatment. So then they're looking to get it, and they think we could do it for them. So a lot of times you just practice your patient, you know, bedside manner and whatnot, and then you say, you can wait for us, or we can refer you out to a dentist in the area that can do it. And then that's usually what ends up happening. So, I mean, I just look at it as like you have your, lemons, and then we're making lemonade, because we have to have a good outlook on things. We can't just get frustrated that we can't do these crown preps, or we can't do a bridge prep or anything like that. Really what we're doing is we're working on our bedside manner and practicing connecting to patients. And that's what we're using this time for right now.
Right. And I mean, you really got to go down that path and have that mindset where you still can accomplish something regardless if there's less treatment.
Absolutely. And I don't know about you, but like the good feeling of being in clinic right now when a lot of schools aren't in clinic is pretty huge. Like I feel pretty special that our school works so well and so, diligently to get us in, even if it's reduced hours.
Yeah.
That's big. And the hard thing too is with clinic, that I find is it's very fluid so far. So trying to get a patient in, you might not have one scheduled on Monday, but come Wednesday, you have a patient and you didn't know about it. So you walk in 8 a.m., the patient's showing up at 9 a.m., and you're fumbling to get things going.
Well, it depends on what the schedule's like.
It's true. School. It is. I mean, it doesn't happen every day that way, because sometimes you have something scheduled and you do it, but it does. It has happened. So does that normally happen in private practice? Maybe not. Usually you have your schedule and you have emergencies walk in, but for it to happen, once or twice a week, I mean, it teaches you to do impromptu dentistry. You can just go with the flow. You got to be like water, like Bruce Lee says.
Yeah.
But I don't know, Seth. What's your, I guess, what are you looking forward to most so far? Like in summer or for the rest of D3 year, hopefully if we can get back in a clinic full force.
I'm trying to just start ripping some crowns. I mean, we can't do implants really. So,
yeah.
I mean, we got to implant, what is it called tomorrow?
Implant workshop or something?
Implant workshop, start learning about some implants, like hands-on. We already went through a whole implant course, but I guess do more of the hands-on stuff with implants. That should be fun stuff. We just had the new class just matriculate. I know a lot of schools, they just are getting started. A lot of schools are starting a little bit later as well. So, got to meet a lot of the D1s, really cool. And I know they're really excited, especially, right now they're getting all their D1 kits, all their dental supplies, and they call it Christmas in July. So, I mean, it's great.
And it's funny, you could always tell the D1s because they're the ones that are always smiling. They haven't been defeated and bashed up and everything yet.
Right, yeah.
So,
I mean, what do you think is like one of the most difficult things that we've had to deal with? I know today, oh man, so this is the first time I've actually had to do all the face shield stuff today.
Man.
And there's protocols that are different at every school, and we go all out. We got double mask, N95, face shield, gown, everything, whole 9 yards. Only thing, I'd be interested to see how they do the vacuums that are right next to the patient's face. Have you seen that yet?
Yeah, those are pretty intense.
Yeah.
I don't know how. That's a lot. You have to buy like 100 of those things for the school.
And those I would assume they're expensive, but
yeah.
What are some of the that's one of the challenges I face.
Man.
Also, the face shield fogs up. So, what's something that you've faced as a challenge?
Well, with that, it looks like they took the cap to a rotisserie chicken, and like the big dome plastic part, they took it off and then just stuck it to your face.
Yeah.
It was tough, like getting used to it, because it fogs up and then there's writing on it from like the company that made it, so you have to see through the writing. So I've been doing a lot of practice if I don't have a patient on like drilling on the mannequin and whatnot on Dexter, so I can practice getting used to seeing through the fog, or practice sweating through my masks and everything, because it gets hot in that thing when you're breathing.
Practice sweating through your
mask.
mask.
Because you practice getting used to it, I guess. So it's comfortable, because then when you're with a patient, you get the pregame jitters come in, and then you're nervous, your mouth gets dry and stuff, and then
does that really happen?
A little bit.
Not happen
Okay, the first patient I ever had, it did happen, and then once I realized there are people too just coming in for care, I was like, all right, and I could calm down. But I could guarantee you the first time I'm doing like a crown prep on a live patient, the tongue's in the way.
Oh yeah.
I know I'm gonna be all worried.
Well, the thing that's gonna be, I mean, you remember the first time you were probing, and there's only two. You can't do it perfect your first time probing.
No.
You're either probing, they're like just ripping through their gums, or just like not even. You're going 1 millimeter.
Yep.
And not doing anything.
They got 4 millimeter pockets. And you're like, oh, it looks like a 1.
Yeah. Because you're too
what
afraid to push down.
And then if they start bleeding, you're just like, it's my fault. Usually they have bleeding upon probing. It's the patient, lack of home care. But if they start bleeding, you think it's your fault. Oh my God, I gotta call somebody in here. Like,
Yeah.
oh man. But no, I would say one thing I'm really trying to do is just get used to the PPE, like the huge change, because we used to wear one mask, a gown, and then your eyewear, loops, goggles, whatever you want to wear,
Gloves,
and then gloves. But that's like usual, you know. We did that.
It's just a lot more headgear.
It is because
You know? Well, the thing though, you can't even wear your loops. Like I can't fit my.
I know.
Well, you can wear the loops, but the problem is that the light doesn't fit in there, and then also the whole face shield fogs up. However, for some reason, like I can't see out of the face shield, but when I look through my loops, I can see through it. It doesn't fog up.
I have the same problem.
It's weird.
I know what you're saying. So I'm like talking to the patient like this. I had to wear it one time, and I had the loops. I'm just standing there looking at him like this. I could see through it. And then the guy was like, "You could take that off." I was like, "Okay." And yeah, he has no decision making authority. That thing came right off because I couldn't see through. You can't breathe in it. And then the N95 mask plus the surgical mask pulls on your ears and they start hurting.
How about the breathing?
Oh yeah,
the breathing is.
I'm getting heart palpitations, like I'm in my inhaler or something. Yeah, you have to. It's labored breathing. It's a struggle, but all these things are just going to be something to adapt to, and we'll get through it. It's really not that big a deal once you start with the patient. You get preoccupied. It's kind of like before the patient gets there, and you're, taking 15 minutes to gown up and everything.
Well, you know what I'm thinking now, because we're talking about all this stuff. Obviously, this is a barrier for providers to be in the room and treating patients directly. So this whole situation not only further accelerates the topic we've discussed before on the podcast, which is robotic dentistry, where they actually already have some of this stuff where they're developing it.
Like the Da Vinci surgery system, for medicine.
Yeah, but so it's basically like almost like a device that you place in the mouth, and it's already, you already scan the mouth and everything, the teeth, and it attaches to one of the teeth, and it starts drilling the tooth and does like a perfect crown prep. But I mean, we'll see how long it takes to get it so that it's perfect, so that it's not, so the patient's not deciding, do I want a robot going in there and hopefully they attached it right and it doesn't fall out and cut my jaw off or something like that, versus an actual clinician. So interesting. But I mean, think about it. If you use the robot, there's no exposure to any disease. You're right.
There's no exposure, but then, if you have to make a quick game time decision, are you going to be ready in PPE to just walk right in the room and do what you got to do? These are things you got to think about too, in terms of, if let's say the patient has a medical event, like a cardiovascular patient has an MI in the chair. You got to get in there. You got to do what you got to do. Like, let me get my N95 and my glove.
Yeah, well, I mean, you should be able to do that anyways.
Yeah, so I'm saying, would you be fully gowned up in PPE just in a different room in case something goes sideways?
Well, think about it as providers in like actual practice. You're seeing a patient after patient after patient.
Yeah,
consistently. It's not like at a dental school where you see one patient in the morning, one patient in the afternoon. Today, when I did that splinting, that was literally 3 hours. Half of it is because I'm the worst person at using the computer system, the charting, and not the charting, but just it's tough.
Dentistry is easy. It's the computer. I should have went to school for IT. I really should have. I've never in my life. I don't even get embarrassed anymore. I just tell the patient, I'm like, I'm sorry, I'll be a really good dentist for you. I'll be a really bad computer technician. And they'll just be like, what do you mean? And I was like, if you can work this computer system, you should be in dental school, because the dentistry is the easy part. And they'll just be there, oh, okay. Like they don't understand, like they overestimate how good I am at these computers. Oh, you'll be fine. I'm like, no, I'm not. I have somebody running in, a preceptor coming in. It's a struggle. But I mean, we'll learn it. We'll get through it. It's just, we've only been doing it for a few weeks now. So
yeah. What are some other things you're looking forward to in summer? Well, I guess summer's over.
Summer's over.
We're
starting
semester.
Fall this week.
We bought, we bought the golf membership last year, and that was easy. Like, that was fine. But how many times did we golf this? We have a membership, but we didn't even golf.
We golfed.
We've been busy doing too much other stuff.
We did a few times. The podcast definitely isn't conducive for golfing. Usually,
is a lot of work.
Yeah, it is. But I would say we could golf more now, since we just finished exams. We could probably plan a day, maybe Thursday or something. We could get, oh, here we got to check the planner. We could try for like the back nine, maybe something, just for
back
funsies.
Nine.
Yeah, and we can't play full 18. But
why not?
Because I don't know if we'll have the time.
Oh well, Matt, we just got a second gym membership, so that's always exciting.
Yeah.
Thinking about doing a little bodybuilding, competing in fall, so we'll see.
Even days at LA, odd days at Crunch. It's just
There you go.
Got to get your money's worth for both of them.
Yeah.
But
You gonna do it?
compete? I mean, I could. It's just that's another thing to add to the plate. We got the podcast, we got competition, and then I mean, golf's gonna have to get put to the wayside at this point.
Oh man.
Unless we add another hour in the day to go golfing.
Yeah, but then we got all the other things. Business club, ASDA, like an SGA.
At this
goes
point,
on.
I can't even nap,
Goes
so I
on.
can't get my afternoon napping anymore. But I'm trying to think in terms of clinic. Just honestly, what I want to do is I just want to be able to speak to patients and relate to them very well,
Right.
because that will also help with case acceptance. And I
Right.
think that's the most we can do right now, since we're not cutting teeth. And then once we get like fully cleared and we can start aerosol procedures, I would just say work on speed and get it quick, because the patient doesn't want to be there any more than they have to. So if you can get it done quickly, they'll appreciate that with as little pain as possible.
Right. And I mean, if you're talking to them the whole time and they appreciate you being there and all that sort of stuff, because that's the one thing that you definitely have time, like you said, to do is talk to patients. When you're seeing one patient for 3 hours, right? They're in the chair for 3 hours. You better be talking to them.
Yeah.
So
you need
if
to talk a
if
lot.
any of you guys who are listening want the Kalish case acceptance protocol, email us at dentalstudentvibes@gmail.com and I will send that to you. Real basic stuff, real easy, but it's like easy questions to get the patient to just open up to you. I know those of you in clinic, some people are like, they just kind of sit down and they just turn their back because they don't even know what to say to the patient.
Exactly.
So it's just kind of like,
It's all about positioning as well. Like, never put your back to the patient, because then they kind of feel alone. I always try to, like, even when I'm working on the computer, that way they can see like more of a front half of me. So I'll, just kind of orient myself,
Right.
towards them so they can see me. And that goes a long way, because they feel a little bit more comfortable.
right.
And I pride myself on making the patients feel comfortable,
Right.
because nobody wants to be uncomfortable in a dental chair. This guy's coming in dressed like some, mad scientist with all this stuff on here.
Mm-hmm.
Can't even, he sees like my eyes like this, and then that's it. And then maybe my wrist if the gown comes up. So you want them to seem like they're dealing with a person rather than this like crazy guy walking in. That's how I view it if I was going to be the patient. But
I gotcha.
yeah, I
All
mean,
right.
X-rays too. We're getting really good at X-rays. That's all we can do. X-rays.
Oh, yeah.
And talking to patients. That's
Right.
all we do right now.
So I mean, that's our that was our summer in a nutshell.
Yeah.
We were looking forward to. We went to FDC last year, the dental conference in Florida, and this year it was supposed to be because usually it's in June, but usually we were supposed to have the ADA/FDC, the Florida
The
and
big
the
one.
National in Orlando, and we are gonna go to that. Guess what? Got canceled. So that would have been a lot of free junk in the bags.
I would have just brought a wheelbarrow.
A wheelbarrow,
And just
yeah.
have them throw stuff in.
Yeah.
I mean, that would have been clutch. Plus the
Yeah.
amount of contacts you can make, and
Yeah.
I mean, I'm sure anything involved in dentistry would have been there too.
Yeah, of
That would've been a
course.
sight
I mean,
to
if
see.
it's the national one, but
Yeah,
yeah, so
definitely.
that got canceled. I'm almost positive they're doing it virtually.
Yeah, well,
You
you can't
know.
get free stuff virtually.
Yeah, I mean, will they send it to us?
I mean, I'm sure if you ask, because they have some good stuff like those
Yeah.
stress balls and the pens. Sometimes you get a really good pen out of a bunch. I got a pen from FDC last year. I use for the patients now, and it's my clinic pen. It stays in clinic, but it writes really well. It like glides. I'm weird like that. I geek out over pens,
Yeah.
but
All right, Matt. Well, it's been a
it's been a slice.
and also we're getting some awesome interviews. We got some very exciting interviews
big
coming
time.
up for you guys. I mean, it's getting serious, So we look forward to sharing that with you guys. And of course, thank you as always for tuning in to Dental Student Vibes. We couldn't do this without you. So thank you guys.